And while sanctions on Russia are being stepped up over its invasion of Ukraine, the funder and promoter of the country's COVID-19 vaccine, Sputnik V, has found itself the subject of punitive international sanctions. And this alongside Russia's central bank. And from the Johns Hopkins Coronavirus Resource Center, over 10 billion vaccines have been administered across the world. Infections are at plus 440 million COVID-19 cases, almost 6 million deaths. We're also seeing today's figures. Countries continue to record more infections. Ukraine, Russia are also caught in the pandemic. Well, joining us now, Tarek Jazirevich, spokesperson for the World Health Organization, joins us from Geneva. Thank you for joining us on the program.
Thank you.
How concerned is the WHO about the unfolding humanitarian emergency in Ukraine?
Well, obviously, we are very much concerned about the state of health system in Ukraine today. The health system is under immense pressure. First, the system was already overstretched with 2 years of COVID-19 pandemic. Many health services have been postponed because of this pandemic. And now health workers are facing people coming with injuries, traumas, on top of patients with other diseases. And health workers have to take care of themselves and their families. So the work they are doing right now is truly heroic. We see images of patients being treated in shelters, women giving birth in bunkers, and health workers are still there trying to assist everyone. Our job now is really to try to help them do their job in the best possible way. The access is crucial. That we had prepositioned some medical supplies within Ukraine, but some of our warehouses are not accessible. We are bringing more supplies. Just today, we brought 39 metric tons to Poland. But how can we actually bring those supplies so much needed, for example, for surgeries, to health workers? We need really a humanitarian corridor to be able to do that.
So attacks on, healthcare are in violation of international humanitarian law. But what can you tell us as to if there have been major hits, healthcare centers around Ukraine?
We have seen and received reports on attacks on healthcare facilities and healthcare workers. One of them we were able to verify when 6 health workers were among casualties. In every conflict, the WHO calls for protection of health. Health should never be a target. Health facilities, health services, and health workers. This is part of a humanitarian effort to provide healthcare to those who need it in time of the conflict. Our purpose right now is to sustain and preserve health system, to keep it running, so health workers can provide healthcare to those who need it.
We're jumping from one crisis to another, aren't we? First of all, the COVID-19, and now it's the war in Ukraine. So prior to the conflict, though, Ukraine had experienced a surge in the number of COVID-19 cases. Low rates of testing means that there is likely to be a significant undetected transmission. Is the WHO worried of increase of large numbers of people developing severe disease?
We are very much concerned, and as we have been publicly stating in the past couple of days, Ukraine hospitals are running out of medicines, and some of these medicines are needed to treat COVID-19 patients. For example, 3 major oxygen-producing plants in Ukraine have stopped, and as you know, oxygen is a critical tool we have at our disposal to treat severely ill from COVID-19. Ukraine was in a 4th wave of COVID-19 since January. Like in other places, dominant variant was Omicron, so less people were in our hospitals. But now, with a suspension of COVID-19 vaccination in many places, with the lack of oxygen, with people not being able to keep the distance and do all these protection measures, we are really afraid that we can see more cases, more severe cases because of lack of vaccination. In Ukraine, we had only about 40% people who have been fully vaccinated before this military offensive. So we are very much afraid, and we need to do everything possible to try to bring in critical medical supplies such as oxygen, so those who are developing severe COVID-19 can be treated. This also goes for people fleeing Ukraine. We hope that hosting countries will provide vaccines for polio, for measles, for rubella, but also COVID-19 vaccination to refugees arriving to neighboring countries.
And Tarek, also, I mean, in terms of partnership, it seems, well, some countries are already taking sides in this war. And I know that there are, partners who provide aid and support to the WHO. Have you seen any withdrawal in terms of those who have made promises? And this is as you, of course, provide support to Ukraine.
Well, we have released immediately over $5 million from our emergency fund, and we launched yesterday an appeal for next 3 months. We are asking for $45 million just for our operations in Ukraine and $12.5 million for our support to neighboring countries. It's really important that neighboring countries can step up the disease surveillance. Because we are talking about vulnerable population coming across border, people who have, because of COVID-19 pandemic, have been postponing their health interventions. Now there are risks of infectious diseases. There is a risk of waterborne diseases as they may be in crowded spaces, more risk of COVID-19 transmission. So we need really to help neighboring countries offer services to refugees, and we should never really forget mental health component as well. These people are coming after going through a very difficult time, so psychosocial health is very important as well.
I wish WHO and other agencies the best in this. Thank you so much, Tarek Jezerevich, spokesperson for the World Health Organization. Thank you for joining us on the program.